Hi folks, this is Derm Dad. I want to take a few minutes to talk about a particular medication that we use for acne quite frequently in our clinic called Spironolactone. It is also known as aldactone. It is a blood pressure medication, but it does block the testosterone receptor and is quite effective in patients that have a hormonal type of acne. So acne that's kind of cystic on the jawline, usually in females, usually tends to fluctuate monthly, that kind of thing. And it's often more of an adult acne problem. So usually after age of 20 or in the mid 20s and 30s, tend to see this more often. Can see it later as well. So in these cases, spironolactone is a great treatment based on the particular symptoms of that patient. Generally, in our case, we try to use 50 milligram tablets, and in my experience, we see a pretty good result at about 100 to 150 milligrams per day total dosage. So oftentimes we'll start at a lower dose and slowly bump it up. So what things to watch out for spironolactone? The first thing is spironolactone is a potassium-sparing diuretic. That means that it increases your potassium level, which is an electrolyte. Potassium is obviously very important. We try to check a blood potassium level early on just to make sure there isn't any issue. But things to watch out for if you're having unusual muscle cramps, weakness, fatigue, unusual headaches, you feel like your heart's racing or palpitations, those would be all signs that it might be worth checking the potassium level. If you eat foods that are potassium rich, such as bananas, potatoes, some vegetables, things like that, or take any kind of supplements, then that can clearly affect the potassium level as well. So if anything changes in terms of your daily routine or diet or exercise, it's usually worth discussing that with your doctor and perhaps check the potassium level, make sure it's not out of whack. Second thing, it is a potassium-sparing diuretic. What that means is it is a blood pressure medication, and it can lower your blood pressure. So usually at the doses that we use for acne, it's not a problem. But occasionally you have someone with low blood pressure, to begin with before they're on the spironolactone. And in those cases, they can have issues with tolerating it. So signs to watch out for: if you're feeling kind of faint or dizzy, just kind of feel like your blood pressure is running low, or feel like you have a weak pulse, things like that. If you're dehydrated and don't feel well, those would be issues to kind of watch out for with spironolactone in particular. Another issue that we see not frequently, but once in a while, is irregular menstrual cycles. Spironolactone can definitely do that. Sometimes it's minor and people don't have an issue with it, but occasionally it can be severe enough to where patients want to come off of the drug. So be aware of that as well. Now, as with any drug, there can be other potential issues, so definitely keep an eye out for things, discuss it with your doctor. This is just a brief overview, but otherwise it generally works very well, and our patients tend to like it. So if you have any questions or comments, go ahead and post them. I'd be happy to take a look. And otherwise, I appreciate you watching. Thanks.